When it comes to evaluate outcomes, there is a few simple changes, just a few. RNs, never delegate anything you can eat. Never delegate education, never delegate teaching, and never delegate first assessments. LPNs, when it comes to evaluate outcomes on the NCLEX, you will never teach. You will never do the first assessment, and you will never do the education, the teaching. By that I mean on the NCLEX you're going to see a lot of have the patient demonstrate or have the patient tell you. I'm talking to the LPNs, right? Those are just the two little minor differences. I will get into it more in this video. So let's continue. So now we come to the sixth and final step of the clinical judgment measurement model, and that is evaluate outcomes. Now, when we evaluate outcomes, we have to make sure that the patient is ready for discharge. If they are not ready for discharge, then we have to go back up to step 4, right? If they are not ready for discharge, we have to generate other solutions. We have to take other nursing actions, and then we have to come back down and evaluate outcomes again. So we have this 71-year-old client who's one day post-op following a bowel tumor removal. He ultimately was diagnosed with phlebitis in his IV. That was a developing problem. So we went back up and we made a care plan for that, right? So here, hopefully his phlebitis has been taken care of. His tumor has been removed and is being cared for. So now we have to evaluate him for discharge. Is he ready to go? So in these unfolding case studies for the NCLEX, we read the question, select to indicate whether the assessment finding shows that phlebitis at the IV site has improved or declined. So here the question at the very end is focusing on his phlebitis. Now, before I go any further, select to indicate whether the assessment finding shows that the phlebitis at the IV site has improved. All right, quick side note. LPNs, when it comes to evaluating outcomes, you will see a lot of have the patient repeat the instructions, or have the patient demonstrate back to you, or, does the patient understand, right? Because for the NCLEX, not the real world, RNs and LPNs practically do the same thing in the real world. For the NCLEX, do not get offended. For the NCLEX, LPNs do not do first assessments. LPNs do not do teaching. And LPNs do not do education. For the NCLEX, you can do simple demonstrating and have them demonstrate back. Okay? So has the assessment finding declined or is it unchanged? Something like this you can do because they're ready for discharge. It's just a matter of, has it improved, has it declined, or has it unchanged? So you will see a question like this because it's pretty straightforward. Read the chart and tell me yes or no, right? Okay. So here we go. Purulent drainage. Well, we go down to drainage here. I think, let's read this, purulent drainage. Okay, so we go down to drainage here, and it says vital signs, it says neurological, it says integrity, integumentary, it says gastrointestinal, it says respiratory, cardiovascular, it says no cyanosis, capillary refill 3 seconds, no edema or tenderness in the lower extremities, denies lightheadedness or weakness, reports discomfort at the IV site, 6 out of 10. It's red, warm, swollen, formation noted along vein, palpable cord-like vein. So it doesn't say anything about purulent drainage. So if there is purulent drainage, the patient has declined. Temp of 101. Well, if we read up here at vital signs, temp is 101, so the temp has not changed. Discomfort at the IV site, 4 out of 10. We just read that it was 6, so 4 out of 10 is an improvement. Palpable cord-like vein, 1.5 inches in length. We just read that it was just a palpable cord-like vein. It didn't say the length, so I'd say this is declined. The site is red and swollen. We just read that the site was red and swollen, so it is unchanged. Streak formation noted along vein is unchanged. We just read that. So we click on submit, and sure enough, we got 6 out of 6 correct. We got all of them correct. So the takeaway when it comes to evaluate outcomes is just 2 quick things. Number 1, if your client has not improved, you have to go up to step 4 and do a new care plan, do new nursing actions, and reevaluate. Number 2, never delegate RNs, never delegate what you can eat, never delegate education, first assessment, and teaching. LPNs for the NCLEX, you will not educate, you will not do first assessments, and you will not teach. You will ask the client to demonstrate their understanding. That's a lot of it. To demonstrate if they know how to read the instructions of their medication. To repeat back to you if they know what their medications are for. To demonstrate how to take care of their wound care or whatever it is. You will not be educating, doing first assessments. You will be doing repeat assessments, things that remain the same. You can do repeat assessments, but like, for example, LPNs, if a patient comes in with a cardiac, a heart attack, let's say, you will not be doing the admittant assessment. The RN has to do that. And we'll discuss that more in the tutoring session. These are just the 2 things I want you to remember real quick for this video. Alright guys, I will see you in the next video. Keep up the good work. Do you need help passing the next generation NCLEX? Are you just not sure how to navigate your HESI, ATI, or your NCLEX studies? Caring for You Tutoring Services has been helping students pass their state boards since 1997. Contact me today.